contributory factor to the increased incidences of EIDs is the development of resistance against antibiotics by certain microbial pathogens. To name a few, we have drug-resistant Mycobacterium tuberculosis. In the past, we were already able to devise treatment regimen to totally cure M. tuberculosis infection. But presently, we have acknowledged the existence of M. tuberculosis strains that are resistant to the antibiotics that are used to kill them. Another more popular example of an antibiotic resistant bacterium is MRSA, methicillin resistant Staphylococcus aureus, that can cause toxic shock, or not toxic shock, but can cause scalding syndrome in newlyborns, since it's a common bacteria in the skin. No? MRSA is known as one of the potent HA infectious pathogens, hospital acquired infectious pathogens, alongside with another species, Pseudomonas aeruginosa. So also an identified antibiotic resistant pathogen. Lastly, uh, notification, or disease notification, or disease reporting is another factor. No? In certain countries in which it will be costly to employ a system to report the incidences and prevalences of a certain disease, it is possible that this factor may contribute to not seeing how the disease behaves, or how the disease works in the population of, or in a big in the big picture. Hence, this might lead to not recognizing factors that can be used to treat or can be used to prevent the spread of such infections. Now, the last portion of Module 4 will be topics or discussions on epidemiology. Epidemiology is defined as the study of disease transmission, incidences, and frequency. In this science, we collect data and analyze them with descriptive statistics in order to recognize variables or factors that interplay and give a disease a recognizable pattern. And this pattern is used by epidemiologists in order for them to draft policies and intervention plans in order to control or confine an infection, a microbial or non or yeah, a microbial infection in a certain place, in a certain locality. Okay. Different countries, agencies, government or federal agencies exist in order to handle the task of studying and establishing disease patterns, disease dynamics. The most popular one that probably you've heard about is CDC. No, CDC stands for Centers for Disease Control and Prevention. In the United States, it's a major agency, source of epidemiologic information, helping medical personnel, health personnel in controlling or participating in the control of microbial infections. CDC publishes the MMWR, or the Morbidity and Mortality Weekly Reports for certain notifiable diseases. No? It's defined morbidity and mortality in the light of the function of Centers for Disease Control and Prevention. So, morbidity is said to be the incidence of a specific notifiable disease. So, simply, it's the incidence of a disease that is categorized as notifiable. Mortality, on the other hand, refers to the number of deaths from that notifiable disease. If we are going to express them in rates, we will be using a denominator for morbidity rate that will be the number of people affected and the total population in a given time period. On the other hand, mortality rate refers to the number of deaths from the disease over the total